The bright fluorescent lights of County General Hospital hurt Tanya Wilson's eyes as she stumbled through the sliding doors. Her hand was pressed firmly against her side, where a sharp, stabbing pain had been growing worse by the hour. What had started as a dull ache during her undercover operation had now become almost unbearable. Tanya took a deep breath and approached the front desk. The waiting room was packed with people, some coughing, others holding ice packs to swollen limbs, a child crying in the corner. A tired-looking receptionist barely glanced up from her computer screen. "I need to see a doctor," Tanya said, her voice strained. "I have severe pain in my lower right side. It's been getting worse, and now I have a fever too." The receptionist pushed a clipboard toward her. "Fill these out and take a seat. We'll call you when it's your turn." Tanya looked down at the forms, her vision blurring slightly as another wave of pain hit. "How long will the wait be? I think this might be serious." "Everyone here thinks their problem is serious," the receptionist replied flatly. "Just fill out the forms and wait like everyone else." Tanya nodded and took the clipboard. As she turned to find a seat, she noticed a white woman with a sprained wrist being ushered immediately into the treatment area. Tanya frowned but said nothing. Maybe they had an appointment, she thought. Finding an empty chair between an elderly man and a young mother with a fussy baby, Tanya sat down carefully. Each movement sent sharp stabs through her abdomen. She tried to focus on the intake forms, but the letters seemed to swim before her eyes. The fever was definitely getting worse. 20 minutes passed, then 40. Tanya watched as patient after patient was called ahead of her, many who had arrived after she did. A college-aged guy with what looked like a minor cut on his hand. An older woman complaining of a sore throat. Even a teenager who was laughing and texting on his phone 1 minute, then clutching his stomach in agony when his name was called. After an hour, Tanya approached the desk again. Her shirt was now damp with sweat, and she could feel the heat radiating from her face. "Excuse me," she said, trying to keep her voice steady. "I think my condition is getting worse. Is there any way I could see a doctor soon? The pain is really bad now." The receptionist glanced up with an expression that mixed boredom and irritation. "Like I said, we're very busy. Everyone has to wait their turn." "But I think I might have appendicitis," Tanya pressed. "My side is extremely painful, I have a fever, and I'm feeling nauseous. These are serious symptoms." "Do you have any medical training?" the receptionist asked with a raised eyebrow. "No, but..." "Then please let us decide what's serious. Take your seat." Tanya returned to her chair, fighting back both tears of pain and frustration. She noticed a security guard watching her closely now, as if expecting trouble. She looked around the room again, noting patterns in who was being treated quickly and who was left waiting. The realization made her stomach sink even further. Another hour crawled by. The pain had become a constant, throbbing presence that made it hard to think straight. Tanya had filled out her forms long ago, but her name hadn't been called. She watched as a white family, who had arrived only 15 minutes earlier, was promptly taken to an examination room. When she couldn't bear it any longer, Tanya made her way to the desk a third time, gripping the counter for support as a wave of dizziness washed over her. "Please," she said, her voice barely above a whisper now. "Something is very wrong. I need help." The receptionist sighed heavily. "Fine. I'll see if one of the doctors can squeeze you in. But you need to understand that emergency rooms have to prioritize the most urgent cases." 20 minutes later, Tanya's name was finally called. By then, she could barely walk without doubling over. A nurse led her to an examination room, where she was told to change into a gown and wait for Dr. Thompson. "The doctor will be with you shortly," the nurse said, closing the door behind her. Shortly turned out to be another 30 minutes of agony, alone in the cold examination room, wondering if anyone would take her pain seriously. Tanya shifted uncomfortably on the examination table, the paper covering crinkling beneath her. The thin hospital gown did little to keep away the chill of the room. 2 hours had passed since she first walked into the emergency room, and the pain in her side now pulsed with each heartbeat. She checked her watch again. She'd been waiting in this room for nearly 40 minutes. A sharp knock on the door made her look up. The door swung open, and a tall man in a white coat strode in without making eye contact. "Dr. Maxwell, according to the nameplate on his coat, was flipping through papers on a clipboard. "So, what brings you in today?" he asked, still not looking at her. "I have severe pain in my lower right side," Tanya explained, pointing to the area. "It started yesterday but got much worse today. I also have a fever and feel nauseous." Dr. Maxwell glanced up briefly, his expression unimpressed. "Any vomiting?" "No, but I feel like I might." He made a note without comment. "On a scale of 1 to 10, how would you rate your pain?" "It's about an 8 now. It was maybe a 5 when I first came in, but it's gotten worse while waiting." Dr. Maxwell raised an eyebrow. "An 8? Really? People with pain at an 8 level can barely speak." Tanya took a deep breath. "I have a high pain tolerance, but this is definitely the worst pain I've had." The doctor finally looked at her properly, his eyes quickly scanning over her before returning to his clipboard. "Any chance you could be pregnant?" "No, that's not possible." "You'd be surprised how many women come in not knowing they're pregnant," he said with a smirk. "Are your periods regular?" "Yes, and I'm not due for 2 weeks," Tanya replied, trying to hide her frustration. "But this doesn't feel like menstrual cramps. It's sharp, and it's only on my right side." Dr. Maxwell sighed loudly. "Let me take a quick look." He approached and pressed a hand against her abdomen, his touch brief and impersonal. When his fingers pressed near her lower right side, Tanya gasped and flinched away. "Tender there, I see," he noted, but his tone suggested he wasn't particularly concerned. "Could it be appendicitis?" Tanya asked. "I looked up the symptoms before coming in, and they seem to match." The doctor's expression hardened. "I didn't realize you went to medical school." "I didn't, but—" "Then perhaps you should let me make the diagnosis," he cut her off. "What you're experiencing is likely just gas or menstrual cramps coming early. Some women are more sensitive to pain than others." Tanya felt her face grow hot. "With all due respect, doctor, this isn't normal for me. I know my body, and something is seriously wrong." Dr. Maxwell stepped back, crossing his arms. "Look, the ER is packed with actual emergencies tonight. We don't have time or resources to run a bunch of unnecessary tests because you read something on WebMD." "I'm not asking for unnecessary tests," Tanya insisted, wincing as another wave of pain hit. "But shouldn't you at least check my temperature or run some basic tests?" The doctor checked his watch impatiently. "Fine." He pulled a thermometer from a drawer and thrust it toward her. After it beeped, he glanced at it. 100.4. A low-grade fever, which is consistent with many things, including stress. "Stress wouldn't cause this kind of pain," Tanya argued. Dr. Maxwell's jaw tightened. "You'd be surprised what the mind can do to the body. I'm prescribing you some extra-strength ibuprofen for the pain and discomfort." He scribbled something on a prescription pad. "If you're still feeling unwell in a few days, follow up with your regular doctor." A few days? Tanya couldn't believe what she was hearing. "This pain is getting worse by the hour." "You people always think you're dying when it's just gas," he muttered, just loudly enough for her to hear. Tanya froze. "Excuse me, what do you mean by you people?" The doctor looked caught off guard for a moment before his expression hardened again. "I meant people who self-diagnose. It causes unnecessary panic." A nurse poked her head into the room. "Dr. Maxwell, do you need me to run any tests for this patient?" "No, we're done here," he replied curtly. "Just give her some ibuprofen for her cramps and clear the room. We have real emergencies waiting." The nurse frowned slightly, looking at Tanya with concern. "Are you sure? Her symptoms sound like they could be." "I said we're done," Dr. Maxwell snapped. "I'll make the medical decisions here." As the nurse reluctantly left, Tanya sat up straighter despite the pain. "I'd like to see another doctor, please." Dr. Maxwell's face flushed with anger. "There are no other doctors available for non-emergency cases like yours. Take the prescription or don't. It's up to you. But we're finished here." He turned to leave, but Tanya's voice stopped him. "This isn't right," she said quietly, "and we both know why you're treating me this way." Dr. Maxwell turned back slowly, his face a mixture of shock and irritation. "What exactly are you implying?" Tanya gripped the edge of the examination table, fighting through another wave of pain. "I'm not implying anything. I'm stating a fact. You haven't given me a proper examination. You dismissed my symptoms without running any tests, and I heard what you said about you people. I think you're confused from the fever, he said, his voice low and threatening. Be careful about making accusations you can't back up. The door opened again, and the same nurse from before entered, looking concerned. Is everything okay in here? I could hear raised voices. Everything's fine, Dr. Maxwell snapped. I was just explaining to this patient that we can't waste resources on hypochondriacs when we have actual emergencies to deal with. The nurse glanced between them, clearly uncomfortable. Dr. Maxwell, I noticed in her chart that her pain is localized in the lower right quadrant with fever and nausea. Shouldn't we at least run some blood work and maybe an ultrasound to rule out appendicitis? Did you get your medical degree since I last saw you, Nurse Chen? Dr. Maxwell asked coldly. Because last I checked, I'm the one qualified to make those decisions. Tanya looked at the nurse gratefully. Thank you. That's all I'm asking for, proper tests to figure out what's wrong. Dr. Maxwell slammed the clipboard down on the counter. Fine. You want tests. I'll order some basic blood work to prove there's nothing serious going on. But you're taking up a bed that could go to someone who actually needs it. He scribbled something on a form and thrust it at Nurse Chen. Basic CBC and that's it. No imaging unless I approve it first. The nurse took the form with a tight smile. I'll get this to the lab right away. She gave Tanya a reassuring look before leaving. As the door closed, Tanya tried to sit up straighter despite the pain that now radiated through her entire abdomen. Doctor, I understand you're busy, but something is seriously wrong with me. Even if you don't believe me, isn't it your job to make sure? My job is to use my medical training and experience to prioritize care in an overcrowded emergency room, he replied coldly. And in my experience, certain patients tend to exaggerate their symptoms. Certain patients? Tanya repeated, her voice shaking now from both pain and anger. What exactly do you mean by that? Dr. Maxwell's eyes narrowed. I mean people who come in thinking they know better than doctors. People who demand tests they don't need just because they read something online. A young resident doctor who had been passing by paused in the doorway, having overheard. Dr. Maxwell, do you need any assistance here? No, Dr. Patel. I'm just finishing up with this non-emergency case, Maxwell replied, emphasizing the words. Dr. Patel looked at Tanya, noting her obvious distress. Are you sure? She doesn't look well. She's fine, Maxwell insisted, just being dramatic. Dr. Patel hesitated, clearly conflicted about challenging a senior doctor. I could take over if you're needed elsewhere. That won't be necessary, Maxwell said sharply. I know how to do my job. By now, the commotion had drawn attention. Another nurse peeked in, followed by an orderly. Tanya could feel sweat beading on her forehead as the room seemed to spin slightly. The pain had become almost unbearable. Please, she said, looking around at the growing crowd of healthcare workers. Someone listen to me. This isn't right. He hasn't even checked my vital signs properly. Dr. Maxwell's face flushed with anger. That's enough. I won't be questioned in front of my staff. Either accept my diagnosis or leave against medical advice. What about the blood test you just ordered? Dr. Patel asked, confusion evident on his face. A waste of resources, Maxwell muttered. But if it'll shut her up so we can move on to real patients, fine. The word real echoed in the suddenly quiet room. Someone gasped softly. Tanya closed her eyes briefly, gathering her strength. When she opened them, her gaze was steady despite the pain. I've been patient. I've been respectful. But I can't ignore what's happening here, she said quietly. You're not treating me this way because you think I'm a hypochondriac. You're treating me this way because of what you see when you look at me. Dr. Maxwell stepped back, suddenly wary of the several witnesses now gathered. That's absurd. You're playing the race card because you're not getting special treatment. A collective tension filled the room. No one had mentioned race until that moment. Nurse Chen returned with the blood test kit, freezing when she sensed the atmosphere. What's going on? Tanya looked around at all the faces now watching, then back at Dr. Maxwell. With trembling hands, she reached for her purse that had been sitting beside the examination table. I didn't want to do this, she said softly. I just wanted to be treated like any other patient. The room fell silent as Tanya reached into her purse. Her hands were shaking, partly from pain and partly from the adrenaline rushing through her body. Everyone watched, frozen in place, as she fumbled with the zipper. "What do you think you're doing?" Dr. Maxwell asked, his voice carrying a nervous edge now. Tanya didn't answer. She pulled out a small leather wallet and flipped it open. The gold badge caught the harsh fluorescent light, gleaming as she held it up for everyone to see. "I'm Special Agent Tanya Wilson, Federal Bureau of Investigation," she said, her voice stronger than it had been all day. Despite her pain, she sat up straighter, years of training kicking in. The silence in the room deepened. Dr. Maxwell's face drained of color. "I came here as a patient," Tanya continued, looking around at all the stunned faces. "I didn't want to be anything but a person seeking medical help. But what I've experienced in this hospital today is unacceptable." A tall man in a suit appeared in the doorway, drawn by the commotion. "What's going on here?" he asked, his voice authoritative. Nurse Chen spoke up quickly. "Mr. Richards, this is a patient who's been waiting for proper treatment for hours. She's showing classic signs of appendicitis, but..." She glanced nervously at Dr. Maxwell. "But what?" Richards asked, straightening his tie. Tanya had guessed he was a hospital administrator. "But I've been repeatedly dismissed and denied proper testing," Tanya finished, still holding her badge. "And now we know why." Dr. Maxwell found his voice. "This is ridiculous. She's exaggerating. I was about to run tests." "Only after being pressured by your colleagues," Tanya cut in. "And after making comments about you people and how I'm playing the race card." Richard's eyes widened. He looked from Tanya to Dr. Maxwell and back again. "Agent Wilson, I deeply apologize for any mistreatment you've experienced. We take accusations of discrimination extremely seriously at County General." "I'm not making accusations," Tanya replied, wincing as another wave of pain hit her. "I'm stating facts witnessed by everyone in this room." Dr. Patel stepped forward. "She needs immediate medical attention. Her symptoms strongly suggest appendicitis, possibly ruptured by now given the delay in treatment." Richards nodded quickly. "Dr. Patel, please take over this case immediately. Order whatever tests are needed." He turned to Dr. Maxwell. "Doctor, I need to speak with you in my office. Now." As Dr. Maxwell followed Richards out, Tanya heard him start to make excuses. She was being difficult. "I was going to order tests eventually. This is being blown out of proportion." Their voices faded as they walked away. The room burst into activity as Dr. Patel began giving orders. "I need a complete blood count, metabolic panel, and urinalysis stat," he said to Nurse Chen. "And page radiology for an immediate ultrasound and CT scan." He turned to Tanya. "I'm so sorry about this, Agent Wilson. We're going to take good care of you now." Tanya nodded weakly, the badge still clutched in her hand. The rush of confrontation was fading, leaving her even more aware of the pain. "Thank you," she managed. An orderly appeared with a gurney. "We need to move her to imaging right away," Dr. Patel explained. "Can you stand, Agent Wilson?" Tanya tried to slide off the examination table but gasped as the movement sent shooting pain through her abdomen. "I don't think so," she admitted. "We'll help you," Nurse Chen said gently. Together with the orderly, they carefully transferred Tanya to the gurney. As they wheeled her out, Tanya noticed several other staff members watching, some whispering to each other. She hadn't wanted to cause a scene or use her position, but the pain had become unbearable and the injustice too blatant to ignore. In the hallway, Richards reappeared, looking deeply troubled. "Agent Wilson, I want to personally assure you that we will conduct a full investigation into this incident." Tanya looked up at him from the gurney. "It's not just about me," she said, her voice strained. "How many other patients without FBI badges get treated this way and have no power to stop it?" Richards had no answer. He stepped back as they continued wheeling her toward radiology. "The ultrasound should tell us more," Dr. Patel explained as they moved. "But based on your symptoms and the timeline, I'm concerned your appendix may have ruptured due to the delay in treatment." Tanya closed her eyes briefly. "Is that dangerous?" The doctor's expression was grim. "It can be very serious. Bacteria from the ruptured appendix can cause infection throughout the abdomen. We'll need to perform emergency surgery if that's the case." As they pushed through the doors to radiology, Tanya realized this was no longer just about one doctor's prejudice or her own medical emergency. Something much bigger had been revealed today. The ultrasound technician moved the wand gently across Tanya's abdomen, frowning at the screen. The cold gel did little to numb the now constant pain radiating from her right side. Dr. Patel stood nearby, watching the monitor with growing concern. "There it is," the technician said, pointing to a blurry shape on the screen. "The appendix is definitely inflamed, and—" She paused, adjusting the wand slightly. "There appears to be fluid around it." Dr. Patel leaned closer to the screen. "That confirms it. It's ruptured." He turned to Tanya, his expression serious but kind. "Agent Wilson, your appendix has burst. We need to get you into surgery immediately." Tanya nodded weakly. The pain medication they'd given her had taken the edge off, but she still felt feverish and sick. "How bad is it?" "Quite serious," Dr. Patel admitted. "The infection has likely spread into your abdominal cavity. Had we caught this when you first came in—" He didn't finish the sentence, but his meaning was clear. Nurse Chen was already on the phone. "We need an all prepped for emergency appendectomy. Patient has a ruptured appendix with peritonitis." Everything moved quickly after that. As they wheeled Tanya toward the operating room, she could hear the hospital buzzing with activity around her. Staff members moved out of the way, some whispering as she passed. Word had obviously spread about what had happened. Outside the operating room, a distinguished older man in surgical scrubs approached the gunny. "Agent Wilson, I'm Dr. Winters, Chief of Surgery. I'll be performing your operation personally." Tanya blinked in surprise. "The Chief of Surgery?" Dr. Winters nodded grimly. "Yes. Given the circumstances, I felt it was appropriate that I handle your case myself." Left unsaid was the hospital's obvious worry about potential legal repercussions. As they prepared to move her into the operating room, Richards appeared again, now accompanied by a woman in a formal business suit. "Agent Wilson, this is Ms. Lopez, our hospital's legal counsel," Richards said nervously. "She'd like to have a quick word before your surgery." Tanya grimaced through another wave of pain. "Really, now?" Ms. Lopez stepped forward. "I just want to assure you that the hospital takes this situation extremely seriously. Dr. Maxwell has been placed on immediate administrative leave pending a full investigation. We hope you'll consider—" "I'm about to have emergency surgery," Tanya cut her off, "because one of your doctors ignored my symptoms for hours. Can we discuss this after I'm not dying?" Dr. Winters intervened. "That's enough. My patient needs immediate medical attention, not a legal consultation. Please step aside." As they wheeled her through the double doors into the operating room, Tanya heard Ms. Lopez speaking urgently to Richards. "We need to review all of Dr. Maxwell's cases from the past year, especially those involving minority patients. If there's a pattern." In the operating room, the anesthesiologist smiled kindly at Tanya. "We're going to take good care of you. I'm going to start the anesthesia now. Can you count backward from 10 for me?" 10, 9, 8. Tanya's voice grew weaker as the medication flowed into her veins. Before she reached 7, darkness enveloped her. She drifted in and out of consciousness. Fragments of conversation floated around her. "Peritonitis has spread throughout. Could have been prevented if—" "At least 6 hours earlier would have. Lucky she didn't go into septic shock." When Tanya finally woke up properly, she was in a private recovery room. Sunshine streamed through the window, suggesting that it was the next morning. The pain was still there but duller now, managed by medication. An IV dripped fluids into her arm. Nurse Chen was checking her vital signs. When she saw that Tanya was awake, she smiled. "Welcome back, Agent Wilson. The surgery went well. Dr. Winters was able to remove your appendix and clean out the infection." "How bad was it?" Tanya asked, her throat dry and voice raspy. Nurse Chen's expression turned serious. "It was bad. The rupture had happened hours before surgery. The infection had spread significantly. If it had been left much longer—" She shook her head. "Well, let's just say you're very lucky." Lucky wasn't exactly how Tanya felt. She shifted slightly, wincing at the pain from her incision. "When can I get out of here?" "Not for several days," Nurse Chen said firmly. "You'll need intravenous antibiotics to clear the infection. and Dr. Winters wants to monitor you personally. Tanya nodded, too exhausted to argue. As Nurse Chen adjusted her pillows, Tanya noticed her phone on the bedside table. Despite her weakened state, she knew there were calls she needed to make. This wasn't over, not by a long shot. 3 days after her surgery, Tanya sat propped up in her hospital bed, her laptop open in front of her. Though still weak and in pain, her mind was sharp and focused. On the screen was a secure FBI messaging system where she'd been communicating with her team. Her phone buzzed. It was her supervisor, Director Harris. "How are you feeling?" he asked when she answered. "Better," Tanya replied. "Still sore, but the doctors said the infection is clearing up." "Good. I've briefed the Civil Rights Division about what happened. They want to open a formal investigation." Tanya looked out the window at the city skyline. "I wasn't planning to make this official. I just came in as a patient." "I understand," Director Harris said. "But what happened to you wasn't an isolated incident. This could be a pattern of discriminatory care that's affecting countless patients." She sighed. "You're right. I've been thinking the same thing." A knock at the door interrupted their conversation. Nurse Chen entered with medication and a knowing look at the laptop and phone. "I should go," Tanya told her supervisor. "But yes, let's move forward with the investigation." After taking her medication, Tanya asked Nurse Chen the question that had been on her mind. "Can I ask you something off the record?" The nurse closed the door for privacy. "Of course." "Dr. Maxwell, has this happened before? Has he treated other patients the way he treated me?" Nurse Chen hesitated, clearly uncomfortable. "I shouldn't say anything." "I understand. But people's lives could be at risk." The nurse sat on the edge of the bed. "It's not just Dr. Maxwell. There are several doctors who, well, they treat certain patients differently. We've reported it, but nothing ever changes." "Who have you reported it to?" "Hospital administration. They say they'll look into it, but then nothing happens." Nurse Chen lowered her voice. "Some of us have been keeping our own records, documenting cases where we noticed disparities in care." Tanya's investigator instincts kicked in. "Would you be willing to share those records?" Before Nurse Chen could answer, the door opened. Dr. Winters entered with Ms. Lopez, the hospital's lawyer, close behind. "Agent Wilson, I'm pleased to see you're recovering well," Dr. Winters said. "Nurse Chen, could you give us a moment?" The nurse nodded and left, but not before giving Tanya a meaningful look. Ms. Lopez stepped forward with a folder. "Agent Wilson, we've prepared a formal apology from the hospital. We deeply regret your experience and want to assure you that Dr. Maxwell's actions don't reflect our values." Tanya took the folder but didn't open it. "What about the other doctors?" Ms. Lote blinked. "I'm sorry. I understand Dr. Maxwell isn't the only one with a history of providing different levels of care based on a patient's race." Dr. Winters and Ms. Lopez exchanged worried glances. "That's a very serious allegation," Ms. Lopez said carefully. "It is," Tanya agreed. "And the FBI's Civil Rights Division is opening an investigation to determine if there's a pattern of discrimination at County General." The room fell silent. Ms. Lopez's professional smile faded. "That won't be necessary," Dr. Winters finally said. "We're handling this internally." "With all due respect," Tanya replied, "that approach doesn't seem to have worked so far." Later that day, Tanya received 3 visitors from the FBI's local field office. They set up a small recording device and took her official statement about everything that had happened. As she spoke, one agent took notes while another pulled up the hospital's public records on a tablet. According to their own published data, the agent said there's a significant disparity in wait times and treatment outcomes based on patient demographics. That could be explained by other factors, Tanya pointed out, playing devil's advocate. True, but it's enough for a warrant to access their internal records. Over the next few days, as Tanya recovered, the investigation gained momentum. Hospital staff began coming forward voluntarily. Nurse Chen brought in the unofficial records she and other nurses had kept. An administrative assistant from the hospital's records office shared emails showing that complaints about certain doctors had been systematically buried. By the time Tanya was discharged, a week after her surgery, the investigation had uncovered dozens of cases similar to hers. patients with clear symptoms of serious conditions who were dismissed or undertreated, with a clear pattern along racial lines. On her last day in the hospital, the young resident Dr. Patel stopped by her room. "I wanted to thank you," he said quietly. "For what?" "For speaking up. Many of us knew what was happening but felt powerless to change it. It shouldn't have taken an FBI agent almost dying to fix this, but maybe now things will be different." Tanya carefully packed her badge and gun in her bag. "This is just the beginning," she said. "But yes, things will be different now." 6 months later, Tanya stood at a podium in the federal building's press room. The scar from her emergency surgery had healed, but the memory of those painful hours remained fresh in her mind. Camera flashes lit up the room as reporters waited for her to speak. "Thank you all for coming," she began, her voice steady and clear. "Today, we're announcing the findings of our investigation into County General Hospital's treatment practices." She gestured to the row of people seated behind her, fellow FBI agents, lawyers from the Civil Rights Division, and several former patients who had come forward during the investigation. "Our 6-month investigation found clear evidence of unequal medical treatment based on race at County General Hospital," Tanya continued. "We reviewed over 5,000 patient records and interviewed more than 200 current and former staff members." She paused, letting the weight of her next words sink in. "The data shows that Black and Hispanic patients waited on average 60% longer for emergency care than white patients with identical symptoms. They received fewer diagnostic tests, less pain medication, and experienced worse outcomes across all departments." A hush fell over the room as Tanya held up a thick report. This wasn't the work of just 1 or 2 biased doctors. It was a systemic problem that hospital leadership failed to address despite years of internal complaints. A reporter raised her hand. "Agent Wilson, is it true that your own experience as a patient sparked this investigation?" Tanya nodded. "Yes. 6 months ago, I went to County General with symptoms of appendicitis. Despite clear signs of a serious condition, I was dismissed, belittled, and denied proper testing. By the time I received treatment, my appendix had ruptured, causing a life-threatening infection." Another reporter called out, "What's happening to Dr. Maxwell and the other doctors involved?" "The State Medical Board has suspended the licenses of 3 doctors pending their own investigation," Tanya replied. "But this goes beyond individual doctors. The entire hospital will now operate under federal oversight to ensure equal treatment for all patients." At the mention of federal oversight, Mr. Richards, the hospital administrator, shifted uncomfortably in his seat at the side of the room. The hospital's new chief executive officer, Dr. Yamamoto, who had been brought in to help reform the institution, nodded solemnly. After answering several more questions, Tanya concluded the press conference. As the crowd dispersed, Nurse Chen approached her. "I never thought I'd see this day," she said, smiling. "Things are already changing at the hospital. We have new reporting systems, bias training, and most importantly, the problematic doctors are gone." "It shouldn't have taken a federal investigation to make these changes," Tanya replied. "But I'm glad it's happening now." Later that evening, Tanya visited County General, not as an investigator this time, but as a speaker for the hospital's newly established monthly forum on healthcare equality. The auditorium was packed with medical staff, students, and community members. Dr. Yamamoto introduced her with respect. Agent Wilson's experience opened our eyes to problems we had ignored for too long. Her courage to speak up has made County General a better place for everyone. As Tanya took the stage, she saw Dr. Patel in the audience, now promoted to a senior position. Nurse Chen sat nearby with several colleagues who had provided key evidence during the investigation. Even some former patients who had suffered similar discrimination were present. "My story isn't unique," Tanya began. "The only unusual thing was that I had a badge that made people listen. Today, I want to talk about all the patients who don't have badges, whose voices weren't heard, whose pain wasn't believed, whose lives were put at risk." She gestured to a large screen showing a new patient bill of rights posted prominently throughout the hospital. "This document guarantees equal treatment for every patient who walks through these doors. But words on a wall aren't enough. Real change happens when each of you speaks up when you see something wrong." A young medical student raised her hand. "What advice do you have for us as future doctors?" Tanya thought for a moment. Listen to your patients. Believe them when they tell you they're in pain. Question your assumptions. And remember that good medicine isn't just about treating symptoms, it's about seeing the whole person in front of you. After her talk, as people gathered around to speak with her, Tanya noticed a woman waiting quietly at the edge of the group. When the crowd thinned, the woman approached. "You don't know me," she said softly, "but your case saved my life. I came in with chest pain last month. Because of the new protocols, they did an immediate EKG instead of assuming it was anxiety." She touched her chest. It was a heart attack. The doctor told me if they'd waited even an hour longer. Tanya embraced the woman gently. This was why she had pushed forward with the investigation, despite pressure to settle quietly. Not for justice for herself, but for every patient who would come after her. As she left the hospital that night, Tanya looked back at the building's illuminated sign. What had begun as her personal nightmare had transformed into something powerful, a force for change that would protect countless lives in the years to come.